Hi, my name is Christina Nomick. Today I'm going to be doing a renal demonstration ultrasound for you. I'm going to start with the patient in supine. I'm going to be sweeping through the right kidney before I start taking any images, seeing what windows I have to work with. I'm going to attempt to use that liver as a nice window to take any images. I'm also sweeping to keep an eye on any pathology that I may be coming across and anything that I need to investigate further along the way. I'm going to be using the patient's breath as well to pull that kidney inferiorly to visualize different parts of the kidney. So right now I'm going to have the patient take a big breath and hold, please. Okay. Sweeping from lateral to medial. Patient breathe. And there you could see the liver acts as a nice window for us. Patient, if you can, turn to your left. I'm turning the patient in left lateral decubitus to see what windows I have with the patient in that position as well. And here, even though we don't have the liver to use right now, we are getting a nice symmetrical view of that right kidney. Patient, take a big breath and hold for me. Good. Patient, breathe. Okay. So just with the patient's breath, natural breath, I am able to visualize each part of that kidney fairly well. For my measurement image, this may be a good option to have. For the others, I'm going to have the patient back in supine. All right, so right now we're going to be focusing on the upper pole of the kidney. Patient, take a big breath and hold for me. Increasing my depth, lowering my focus. Really trying to focus on that upper pole, which we can see pretty nicely. Patient, breathe. All right, take a big breath and hold whenever you're ready. Good. Breathe. There we can see the upper pole here. Next up is the lower pole of the kidney. So with my probe, I'm going to be towing the probe just slightly to pull that kidney down. Patient, take a big breath and hold. Decreasing my depth. And breathe. There we can see the lower pole. Again, using that liver as a nice window. Next up, we're going to be sweeping from lateral to medial. Patient, take a big breath and hold, please. So here we're coming out of that kidney, starting to see and visualize parts of the kidney. Patient, breathe. Take a big breath and hold, picking up from where I last left off. Took an extra picture on accident. We can always delete later. And breathe. Okay. Now we're going to measure the kidney in a sagittal plane. Patient, take a big breath and hold. And breathe. I am going to measure twice, one with the patient in supine and also with the patient in left lateral decubitus. We're measuring the length in the AP. Our patient's kidney measures 11.7 by 3.8 centimeters. Patient, if you can, turn to your left, please. All right, take a big breath and hold. And breathe normal. Take a small breath in and hold. And breathe. And here our patient's kidney measures 11.7 by 4.8 centimeters. And I'm going to make a notation that we have the patient in left lateral decubitus. Okay, I'm going to turn the patient back supine so we can start our transverse sweep, starting out of that renal sinus, decreasing my depth, or increasing my depth, I'm sorry. Turning down my gain, just to optimize our image here. Okay, patient, take a big breath and hold for me. Okay, here we have that image coming into view. Working our way inferiorly. Hold for 2 more pictures if you can. And good, breathe. Okay, we're ready to take our transverse measurement of the kidney. Patient, when you're ready, big breath and hold. And breathe. Just placing our calipers from there out to the hilum of the kidney, measuring 4.0 centimeters. Okay, now we're going to look at the vasculature of the kidney, of the right kidney. Patient, if you can, turn towards your left. Having my patient in left lateral decubitus once again, showing nice perfusion of the kidney, or throughout the kidney. Lowering our color scale just a bit, increasing our color gain. Patient, when you're ready, take a small breath in and hold. Just to stabilize our image there. And there you are. Breathe. Now in a transverse plane, we're going to show the artery, the main artery and the vein of the right kidney. And I'm just moving around to see what kind of windows I have for a nice elongation of that vein in the artery. Patient, take a breath in and hold. Good. And there we are. color box. And there we can see patient breathe. There we can see the vein and the artery overlapping, diving into the IVC and the aorta. Now we're going to be evaluating the Doppler signal of the renal artery, the right renal artery. Okay, patient, take a big breath and hold. Breathe. So adjusting my Doppler settings here, increasing the Doppler scale. All right, patient, take a big breath and hold. Good. And because we have some overlap there, I'm going to increase my scale just slightly, my color scale, so we get less aliasing. Patient, breathe. So there we can see we're getting both venous and arterial flow, which is sometimes the case when we have some overlap there. Patient, take a big breath and hold. Breathe. Here we can see both arterial and venous flow, but right now we're focusing on the arterial. And just for giggles, we're going to take a nice signal of the renal vein. Patient, take a breath in and hold. And breathe. And there again we have both, but showing the phasicity of the renal vein. Now moving on to the left kidney, I'm going to have the patient roll towards me. So here sometimes we use the spleen as a nice window, which there we can see for that left kidney. Okay. Patient, take a breath in and hold. Before we take any images, we are going to be sweeping throughout that kidney. There we are. And breathe. And lean back just a tad. Thank you. Big breath and hold. Again, seeing what windows I have to work with here. Okay, roll towards me. All right. So starting with the upper pole of the left kidney, everything else is out of focus a little bit, but that's okay. We want nice clearance of that upper pole. Now onto the lower pole. Patient, take a breath in and hold. There we are. Lower pole just right here. And breathe. Okay, take a breath in and hold. Of rib shadowing, interfering, and that's okay. We just need to adjust our position and move around the ribs and the hips. Patient, breathe. Big breath and hold. All right, and breathe. Beautiful spleen. Okay, now we're moving on to the sweep of the left kidney. Patient, take a breath in and hold. Good, right there. Again, moving around those ribs. We're here. And breathe. Now onto the measurement of the kidney. Patient, take a small breath in and hold. And breathe. Patient's left kidney is measuring 11.3 by 5 centimeters in the sagittal plane. And while we're here, I am going to take a nice perfusion image, so we have a good window. Patient, take a breath in and hold. And breathe. And give it another go here. All right, patient, take a big, big breath and hold. Shadowing there. I'm just trying to work around it. Patient, breathe. Just breathe normal. Patient, take a small breath in and hold. Breathe. Not the greatest perfusion image. I know we can do better, so I'm going to keep trying here. Patient, take a breath in and hold. Breathe. Patient, take a breath in and hold. I'm going to take a couple separate images here so that we can show perfusion nicely throughout the upper pole, that lower pole, and the mid pole. Breathe. All right, take a breath in and hold. So now on to our transverse sweep of the kidney, the left kidney, from superior to inferior. Starting out of the renal sinus. Patient, take a breath in and hold. Okay. And move to more posterior to get away from that gas. And breathe. And on to the transverse measurement. Patient, take a breath in and hold. Breathe. Breathing our calipers there, from there to the hilum, measuring about 4 centimeters. To our transverse color of the artery and the vein. Breathe. Just use the patient's natural breath. And there we can see both. Now on to the Doppler. The left renal artery. Okay, take a small breath in and hold. Beautiful. Breathe. And there we can see both the main renal vein and the main renal artery. Turning off angle correct here for the renal vein signal. Patient, take a small breath in and hold. And breathe. Decrease our Doppler scale there just a bit. Okay. And now with the patient supine, I'm going to have them lay on their back. We're going to take a look at the bladder. In sagittal view. And we're going to be sweeping through, measuring any pathology as we go along. Going to be notating any abnormal wall thickening, etc. Decrease our depth here, raise our focus, and get a nice Picture of the bladder and sagittal, turning down our scale or our overall gain there. Okay, now in a transverse plane, be looking at the bladder and transverse, again sweeping all the way out. Okay, and now we're going to be taking a look at the ureteral jets. Here we just wait for them to fill. I'm going to lower my scale a bit, increase my color gain. And this is sometimes a waiting game, so we need to be patient to see if they do fill. I'll lighten up my pressure just a bit. I would give this typically about 5 minutes to see if we can visualize them. I do not see them popping into view. So I am going to freeze that image and just take a picture, and in my sonographer comments I am going to note that the jets were not visualized within that time frame. Oh, and just as we're about to give up, we have the left one popping into view there. So that's good. It wasn't quite 5 minutes yet. Let's see if we can see the right one. Nope. So here I'm just going to take a color image and notate here as well that the right jet was not visualized. If I can spell. And I did wait. Okay, and that is it for my renal demonstration. Thank you very much for joining me.